10 signs and symptoms of an unusual blood clot you should know. The one thing humans cannot do without is blood. Without the blood, the body's organs will starve on the oxygen and nutrients. Actually, it needs to survive. Fighting infections, healing of wounds, or forming blood clots are all near impossible, of course, without blood. Actually, blood clots form a gel-like texture of the blood to prevent excess loss of blood. On the other hand, a sudden clot can lead to serious problems and even death. If you have it in your artery, it can give you a heart attack or a stroke. If it happens in a vein, you can feel pain and swelling. A clot deep inside your body is called a deep vein thrombosis, or DVT for short. These blood clots occur deep within the veins in the legs without any trace or scratch. However, there are cases of an unusual blood clot and its symptoms and signs are quite the risk. In this video, we discuss 10 unusual blood clot signs and symptoms you should know. Before we dive in, don't forget to hit the subscribe button and notification bell. Also, be sure to stick around to watch the video till the end. Number 10. Swelling. According to a study in the European Journal of Obstetrics and Gynecology and Reproductive Biology, swelling is sometimes referred to as leg edema and is the closest sign to having DVT. Although the leg may swell from simply anything, you still have every reason to suspect DVT and seek medical attention as soon as you notice a significant or rather disturbing difference in the two legs. It might come off as a feeling of fluid buildup in the legs, which will restrict your movement as compared to when you are perfectly fine. In any way you look at it, it's a cause for an alarm, and sorting after treatment will save you from a dramatic tragedy. Number 9. Dyspnea, shortness of breath. If there's one thing we know for sure, it is that blood carries around many good nutrients, oxygen, and primarily anything that strengthens the body's vitality while flashing out the unwanted in the bloodstream. Dyspnea is another alarming symptom commonly associated with pulmonary embolism. According to a 2007 study in the American Journal of Medicine, many PE patients suffer from this condition. The condition is quick, rapid, and life-threatening. It imposes abnormal breathing and is an evident sign that a blood clot has found their way into the lungs, restricting not only the blood flow, but now more endangering the airflow. Number 8. Unusual warmth. We mentioned earlier that signs of DVT may be tricky, and that was no lie. Something as common as warmth could be a cause of alarm. You may be tricked to confuse pain with warmth, but these two are very different. On the other hand, pain is one crucial factor we cannot ignore. We'll come to that shortly. As for warmth, it is quite unusual, but one sign that may appear often after moving around along with the pain. But it's a clear sign that you need to see a doctor as soon as possible. If you agree with us, slap the subscribe button right now. Number 7. Skin discoloration. Another rather unusual symptom you may experience is a change in the skin color of the affected area. Many of these symptoms occur together, so you will experience the unusual swelling, breathing, or pain on the inside, while other symptoms confirm DVT on the outside. In this case, skin discoloration. It may appear red or in some cases blue, but whichever color we can both agree that is alarming and worth seeking medical attention. It can be accompanied by an irritating urge to scratch the itchy affected area, which medical practitioners advise not to give in to. A blood clot is a result of inflammation of the veins, and hence like a sting from a bee, you'll only make matters worse the more you touch it. Number 6. Fever. According to a 2011 study published in the Journal of Thrombosis and Thrombolysis, a simple fever can indicate or cause severe outcomes. Fever is as underrated as flu, but both conditions have led to casualties. According to the Centers for Disease Control and Prevention, there was a record high 61,000 flu deaths in the United States from 2017 to 2018. Get checked once your temperatures are rising rather unusually. Number 5. Extreme sweating. Sweating itself is normal. but sweating excessively is no joke. According to a 2015 study published in Case Reports of Pulmonology, these sweats can go as far as in the nights while you're trying to have a good sleep. Talk about the unusual. As suspected, this is another symptom of advanced DVT and PE. It can cause lightheadedness, and you may pass out in the process. Worst case scenario, blood clots can travel to your heart and brain to cause heart attacks and even stroke. Hence, getting properly diagnosed with all urgency will do you more good than harm. Number 4. Pain and tenderness. Pain, as indicated earlier, is a very common sign of blood clot. You'd most likely pay less attention to leg pains by mistaking them for tiredness from walking a few hours. However, this is not a concrete reason. According to a study in 2000 from the Journal of General Internal Medicine, leg pain is one of the most prominent symptoms of DVT. There are severe cases of burning, sharp pains, or tenderness in the leg, more specifically, in the middle areas of the thigh. You will feel them as you walk and notice a significant difference when you take a break from walking. 50 to 75% of DVT patients will experience this pain. Therefore, if you fall victim to this pattern of medical thigh pain, seek medical attention immediately. Number 3. Weakness. When dealing with blood clots, DVT, or PE, the slightest unusual sign is a cause for an alarm. Weakness in the thigh is an indication of DVT, which may not be a major factor, but it is precisely the reason why it is alarming. It is the early signs of a blood clot forming in the leg. Hence, the sooner you notice and report it, the better it is for you. You may feel lazy to move when your body seems to be too heavy for your legs, but that's just the language DVT speaks. Number 2. Chest pain. According to a 2013 study published in Experimental and Clinical Cardiology, most victims of DVT and PE are likely to report chest pains. These pains are not mere but sharp pains that result from developed blood clots detaching and traveling to the lung. The blockage that causes difficulty in breathing, as hinted earlier, will lead to feelings of pain in the chest due to breathing disorders. Number 1. Cough. The latter discussed and dyspnea relative to coughing will prove disturbing or a shred of evidence to the severity of the effects of a blood clot in areas they aren't supposed to be. Simple to say, blocked lungs and abnormal breathing will result in uncontrollably hard coughing. Blood clotting in its nature isn't good news, but where DVT and PE are involved, the simple slightest cough shouldn't be taken for granted. According to the Center for Disease Control and Prevention, 60,000 to 100,000 Americans fall victim to DVT each year. If you have one of those symptoms, don't get panicked. Just get an appointment with your nearby doctor and get diagnosed immediately. And on that note, we wrap up today's video. Let us know in the comments below. For more queries, I have also added some studies at the end of this video description. If you liked today's video, please give it a thumbs up. And don't forget to like, comment, and share. Stay healthy, stay fine.